There are new questions tonight about the C. difficile outbreak at the Nanaimo Regional General Hospital, and there are calls for a policy review. Another look at the contracting out of the cleaning staff at the Nanaimo Hospital. NRGH is dealing with its third outbreak of C. difficile infection since 2008, and this latest outbreak is blamed in 2 deaths. In News Mid-Island Bureau Chief Jonathan Bartlett has the story. He's live in our Nanaimo newsroom with the details. Jonathan.
Hudson, both the NDP and the Hospital Employees Union are insinuating that this C. difficile outbreak and the deaths attributed to it are a direct consequence of contracting out cleaners at the hospital.
There are obvious signs for people entering Nanaimo Regional General Hospital to wash their hands and know that the infection can easily be spread. There's an outbreak here of C. difficile, a bacteria that grows in the intestinal tracts of people taking antibiotics. One person died on April 1st, another on the 6th.
This disease in a healthy individual is an inconvenience. If you're recovering post-surgery or have other serious health problems, and that's obviously why you're in hospital, the outcome can be quite different.
This is the third outbreak of C. difficile at NRGH since 2008. Now some are pointing fingers.
The big picture is that we are seeing the results today of what happened nearly a decade ago when the Liberals came to power.
What happened was the policy of contracting out of cleaning services to private companies.
We have seen ongoing complaints and concerns around cleanliness, and now for the third time in 2 years, an outbreak of C. difficile at Nanaimo Regional General Hospital. This is a Liberal legacy.
The contract company that does the cleaning here at NRGH is Compass Group Canada. In 2009, WorkSafe BC issued a scathing report that found Compass in violation in a number of areas.
Training issues, communication issues, and not providing proper safety equipment for its workers.
There's been WCB investigations. There was a report by the BC Centre for Disease Control. There was a report by the Chief Medical Health Officer. You know, they all talked about issues like workload, about the kind of training workers are given, and they all identified real deficits in how Compass was doing its job at the hospital. So, you know, I think we have to, the health authority has to take some accountability here for the contractor hired.
For its part, Compass Group Canada issued this statement. Compass Group Canada is working very closely with the VIHA infection, prevention, and control staff to ensure normal as well as enhanced infection control processes are in place at NRGH. They also said today that their staff are well trained and in full compliance with all guidelines and IPC protocols.
Additional housekeeping steps should and need to be taken with this particular germ. It is not the usual challenge. You certainly need to be able to have teams who know what they're doing and be able to get on top of this germ quickly, because if you do not and it spreads to the hospital, you can spend months bringing such an outbreak under control.
I don't fault the cleaners per se, but I certainly fault a system that doesn't seem to be able to keep a hospital clean to standards that keep C. difficile out.
VIHA says 12 cases of the disease have been identified at NRGH. It's still too early to say if the outbreak is contained.
And 3 people died in 2008 from C. difficile. VIHA says the bacteria is present in the community as well as many hospitals in the province. They want the public to know the importance of washing hands when entering or exiting any health facility. Hudson?
All right, Jonathan Bartlett reporting. Jonathan, thanks.
You're welcome.